Good afternoon. This is your County Executive Ed Day, and we're here for our weekly COVID-19 update and also some of the happenings around here in Rockland County. So thank you for joining us. The one thing I want to speak of immediately before things get completely out of control. This morning it was reported that we had 42 new cases of COVID-19 here in Rockland County. Just to put in perspective for those who have not been following this, we have been reporting less than 10, roughly 8 cases per day. We've been under the 1% infection rate consistently for some time now. 42 cases is the equivalent of about a 4.6% infection rate. That is a spike. But what I'm telling you is it is not one, which is the important part. As soon as we saw this, and again, this is important because we talk about this a lot, about how we handle numbers and reports when they come in here, how rapidly we jump all over them. This is exactly what happened this morning. This morning, our health department got that report of 42 new cases, and they started looking at them, and still more were coming in. So anyway, they looked at this very quickly, and they said many of the cases were due to late reportings of the lab. These cases are received from ComCare, which is the agency hired by the states to be the clearinghouse for the labs and to bring the results to the local Department of Health. But for informational purposes, the date of reporting to the labs range from 6 weeks to 8 days late. That's how old some of these cases were. Quite a few numbers of these, about a dozen or so, were more than 6 weeks late. Other labs that we don't have yet were tested between August 10th and August 12th. We're waiting from those numbers. And also, we had a number of repeat testing. People who had gotten tested once, I've heard of people get tested and then they get itchy because they haven't gotten a result. They'll go get tested a second time, and if they're positive, that counts as 2 cases, unless we can filter it out. So I'm happy to report to you that no, we do not have a spike, and preliminarily, we will not report this until we know for sure. Preliminarily, we are probably in the area of about 1%, which is where we should be. So I just want to bring that out there because I saw this on my Facebook page, and I want to get this information out to people as rapidly as possible so we don't have any unnecessary angst. Anyway, we do remain in phase 4 of the New York Forward reopening plan, and thankfully we are finally seeing progress at some industries which have been forced to remain closed. Yesterday I was over at the New City Bowl with my dear friend Alice Lenner. Her family has run that bowling alley for a number of years, just a wonderful community lady and a wonderful community family, very engaged in the Chamber of Commerce and other local initiatives. And we took myself and others took part in a reopening ribbon cutting. And I'll tell you one thing, I walked around the bowling alley for a bit, was impressed with the safety precautions that were put in place. I was happy to see so many people once again visiting the bowling alley. Now this was about 11 o'clock, 11:30 in the morning, so it was early. So it was really good to see the people come back and it meant a lot to Alice too. I just want you to be aware of that. Governor Cuomo also announced that gyms and fitness centers will be allowed to reopen at 33% capacity next Monday, August 24th. There are quite a few requirements which are listed in full on the forward.ny.gov website, and that includes something I'm going to mention and get back to: wearing an acceptable face covering at all times. I'm going to return to that. Complete and pass a health screening. So that typically involves getting a temperature check. They'll put a touchless thermometer on your forehead, and they will see if you have a temperature at all. Sign it upon entering the facility, so that could be used for contact tracing later on down the road if needed. Ensure that a distance of at least 6 feet is maintained at all times. And the HVAC system, that has come up again. There's a lot of questions as to whether or not this is really a necessary item, but error on the side of caution. The demand will be that HVAC systems have a filtration of a MERV 13 rating. Now, I'm getting back to the face covering issue. I've communicated with the governor's office today on that because back in June, the World Health Organization actually sent this out, and I'll show it to you. And we had this on hand, so it basically says here the following: sweat can make the mask become wet more quickly, which makes it difficult to breathe, and could promote the growth of microorganisms. The important preventive measure during exercise is to maintain physical distance at least 1 meter from others. Now, some gyms outside of the state have done that. They stopped using the mandating the mask, for cardiovascular exercises because of the heavy work you do and the sweating that comes with it. So what we did do, we brought this information to the attention of all the county execs in the control room, all the governor's staff. I expressed my concerns to them about this, and most importantly, not having a cookie-cutter approach. The important thing here is to make sure that we are healthy. This fix that has been put out right now may be worse than the actual cure. We don't want to see that. So they're going to be taking a look at that information, and hopefully they'll get back to us shortly on that, so we can either revisit this with you, or we can have the guidelines adjusted as necessary. But again, these guidelines are extremely thorough, and I thank the gym owners and managers who will be taking those steps to ensure the safety of those who come to work out. I'd like to turn this over to my Director of Communications, John Lyon, the proverbial man behind the curtain, and we'll go over whatever questions came in today, John.
Okay. Thank you for everyone who wrote in. Today we only received one question, which is a record for us, which either means we've done a great job answering your prior questions or everyone's on vacation this week.
Everybody's going to say I was on vacation. They were on vacation this week, right?
Of course,
okay.
Of course. But as to that question we got today, have there been any changes to hair salons, such as the capacity, etc., or is that all the same?
No, we have not gotten any changes to the guidance previously issued by New York State in regard to hair salons. We seem to be stuck at that current occupancy limit. Look, just so everybody understands, we've gone through this before. These are daily meetings we have with the governor's people, health department officials at times, other county executives, so we share our concerns and we share the input that you all give us. And we frequently raise these issues in that control room telephone conference. And also, we call for the governor to refuse. The governor's office has refused to make changes. I'm going to give you a couple of examples that, not so much, I'm not trying to be critical here, but I think it's important that you understand, just like it's important that I understand where this is all going. Let's understand something. We had a very precise phased opening of our economy. Again, I've given the governor credit for putting us on the right path to begin with. Phase 1, 2, 3, and 4 were 2 weeks apiece. That was to deal with the exposure rates. Slow openings, we had put into place many different systems to ensure that if we see a spike, we have an immediate ability to address it rapidly and to turn down the valve, as it were. And we went through this. And here's what happened. We have been successful beyond belief. We have collectively done a great job. Our infection rate is below 1. That means that the infection really is truly not spiking anymore. It recognizes the fact that, again, this virus has no vaccine. This virus has no known immunity. So what that means is that we have to learn to live with this virus. So it's critically important that we're smart, that we do things that we feel are having an effect. And regardless of the debate about the various different prophylactic measures that are used, or distancing measures that are used, it would appear that they're working. And when you see something seemingly is working, unless proven wrong, you stick with it. So we asked about restaurants. Restaurants have been functioning at 50%. When will they be able to increase capacity, say, to 75%? They didn't have an answer for that question. So I asked them to go back and take a look. I asked a larger question. From my perspective, in being involved in emergency and crisis management and law enforcement, what's the plan? Where do we go from here? We were very structured for 4 phases. Now we were kind of like in phase nowhere. We seem to have been successful through all 4 phases, and we've just, by a large degree, have stopped. That is a problem. Okay, I recall what happened to Alice Leonard in New City of Hull, and this happened to a number of industries. They were told they were in phase 4. Just before entering phase 4, the proverbial rug was pulled out from under them, and they could not open up. Now, what was not I don't think what was fully understood by the powers to be, and I did bring this up, is that many of these industries borrowed money, they did fundraising, they did whatever they could do just to get to July 7th, the date of phase 4. When they were told they couldn't open, it was worse than just getting a punch in the gut. This was something that now where's the money going to come from? What are they going to do? They were counting on that bridge to get to July 7th and then move forward. You can't continue this without a plan. And if I've asked this repeatedly, the calls have not been contentious with the governor's staff. I think they know where I'm coming from. It is critically important to everybody that there is a plan, or at least some sense of where we're going. The way this is going now is, when you're in crisis, uncertainty is the biggest enemy you could have. That it will create havoc upon the psyche of people, which I know you have seen here, and create more issues than we really want to care to entertain. So, in any event, these are some of the things that we are speaking of. I think these are things that I would expect pretty much all of my constituents to want to know. You would want to know where we're going. You would want to know what's the plan. You would want to know what guidance do you see coming down the road for our reopening of our economy, because there's a goal here. The goal here is to get back to normalcy. And that is a critical goal, because we need that now. We do need that sense of normalcy, not a sense of anxiety. And that's really what we're talking about today. Again, we didn't have a lot of questions, so I think I stretched it on that. But anyway, my apologies if I went on too long. But we do have a couple of other quick items I'd like to quickly mention. Anyone who has out there who has not already completed the 2020 census, please complete the 2020 census. More than $675 billion is annually based on census data, and that's a distribution of those funds. And those dollars go directly towards programs our residents depend on, like health insurance, infrastructure, schools, and nutritional support. According to the U.S. Census 2019 population estimates, there are about 107,000 housing units in Rockland County. At the current Rockland self-response rate of about 66%, that means there are about 36,000 households or housing units that have not responded yet. They have not been counted. You don't count unless you engage in the census every 10 years. And the lack of response in direct and indirect funding from the federal government totals about $364 million annually to Rockland County. So it's very important. It is urgent that you do this. There is no reason not to. Nothing in the census can be used against you for any reason whatsoever. So I urge you to go to my2020census.gov or my2020census.gov, or by calling any of the numbers that we posted in the comments section. I'll give you the basic number is 844-330-2020, 844-330-2020. You can call that number directly. If you are not an English language speaker, there will be other numbers that will be posted in the comments section at the end of this broadcast. And now on to another community concern. Before COVID-19, mobile blood drives hosted by high schools, colleges, businesses, and other organizations made up about 75% of the region's incoming blood supply. But that number of blood drives has dropped by 2/3 this year due to the pandemic. I cannot begin to tell you, and these are things that I've seen personally in my lifetime in law enforcement, how critically important it is for us to have a vibrant blood supply. This could affect anybody you know. It could affect you directly. The need for blood during procedures at times are overwhelming. There are people who have been sick who have on the table a long, long time. If you go to any of the blood drive fundraisers, you hear these stories about people who are here today, not only just because of the skill of a surgeon, because the surgeon had the ability to use those skills because the blood supply was there and it kept that person alive. So I'm going to ask you, please, join me tomorrow. I'll be at Rockland County's blood drive tomorrow at Building A up in Pomona. That's a Pomona Health Complex. It is between 8 a.m. and 5 p.m. in the lobby of Building A. Appointments are the only way to guarantee that you have an ability to donate and help maintain the social distancing during the event. I have donated blood. You can donate blood, I think, every 58 days, I believe. I'm pretty much, I give blood every 2 months. So it's something that it's a good thing to do. Again, you're helping your community, and you could be helping your own family. Don't forget that. If you're interested in donating blood during the August 19th blood drive, please make an appointment at the link that will be posted in the comments section after this video concludes. And again, I can't emphasize enough how important this is, that you, please, if you have an ability to donate blood, please do so. And as far as concerns of health concerns that have been added to the mix now because of COVID-19, is that I have donated blood through this crisis. You will feel, I will just say this, you will feel very comfortable with the prophylactic measures that are in place to make sure that the whole experience is safe. That's the best way I can describe it. So with that, John, anything else going?
I'll be donating blood tomorrow as well, along with my wife, who I want to give a shout out to. But if you're not able to make the event tomorrow, the New York Blood Center accepts donations they have donor centers where you can go any day to donate. You just have to make an appointment. And there will be additional blood drives coming up that you can look for and take part in. So.
And I believe they do that at their offices on Smith Street in Nanuet.
Yes.
They're right off Route 304. I think it's 26 Smith Street, I believe, in Nanuet. So again, if you can't make it tomorrow, you know something, we're not going to take it personal. I'll miss you, but I'm not going to take it personal. But please, pick up a phone, contact the Blood Center, and be part of the greater good of this county and what this county is known for, taking care of each other. So with that, I guess we're going to sign off. Check the comment section out for the information that we're referencing in the broadcast here. And until next week, have a wonderful afternoon, evening, and a great week ahead. Take care now.